So you want a premium salary, but do you deliver premium services? That is our topic today on the Heart of Dentistry podcast with Brandi Hooker Evans and Jamie Marbo.
All right, Jamie. So the hiring situation is a mess right now in dentistry. The applicants for jobs are asking astronomical wages. The dentists and office managers that are trying to hire these new professionals to add to their team are stuck between a rock and a hard spot because they feel like they're not going to get anyone to apply if they don't pay these high wages or offer these high wages. And then many of us are like, well, we just need someone with a pulse to be in this position because we are short-handed like crazy. And then open a whole nother can of worms with, if we offer these super high wages for this new team member, what does that mean for our loyal members that we've had anywhere from 2 to 20 or even more years?
Right. It's a huge dilemma right now. So I want to start with a quick story. I have a current client that is in the need. He has a larger practice. There's multiple doctors and multiple hygienists, and they produce quite a bit. They're looking for a new office manager, or he's calling it director of operations, and also a hygienist, a full-time hygienist. And we'll just go with hygiene right now. When we put in the ad for hygiene, he offered it, and he gives lots of benefits: health insurance, 401k, holiday pay, bonuses, you name it, he provides it. Very, very generous, business owner. And he put in the going rate of what his hygienists were averaging and making. Crickets almost. Couldn't really get the right fit. And so then we decided to up it. And we put in about $5 to $8 more than his hygienists were making at the current time. And we got more people to apply. And so we're not even going to mention what can of worms you kind of did, but the people how they're going to feel, right? Like you were saying, how are they going to feel? And now he's going to have to bring everybody up to that same one. So it's not just about the new hire. It's about all the other 6, 7 other hygienists and what they're going to have to be increased to. So his expenditures going out went up astronomically by hiring one position, right? So let's talk about, what does premium services in the hygiene department look like? So Brandi, what's one of your top things that you believe it looks like?
Well, first and foremost, I believe in providing individualized care. And the way that we know that's happening is, what do our perio numbers look like? In the current situation of dentistry, about 80% of all codes coming out of the hygiene room are prophy codes. But we know that half of the adult population has gum disease, and at age 65, that number jumps to 70%, which is old statistics. Those are 2013 statistics, and we've progressively seen our population become less healthy. So when we say, okay, this is our patient base, at least 35% of what we are billing out should be perio code in some form or another. And an easy, making sure you're doing the right thing, is half of your perio codes should be perio maintenance patients that you have going through your regular 3-month recare system. And then the other half should be people that are actively receiving 4341s or 4342s, which is
of that, at least of that 35%. Yeah. Half of it should be perio maintenance and half should be the D43. Yeah.
And I believe that that's at the minimum.
At a minimum. I agree.
At the minimum, because more patients have disease than what we are recognizing. And I believe so first, as a hygienist, you absolutely have to know what entails active infection. And every time I teach a course, people are like, well, what about those gray area patients? And well, here is a take home, write this down, put it in your front pocket for use. Is there bleeding and bone loss? If there's bleeding and bone loss, your patient needs periodontal therapy. If there's just bleeding, then we need to up that preventive.
Correct.
We want to see that prophy, because if we're preventing disease, we need to see them in 12 weeks to make sure that we are getting the bacteria that are causing permanent damage out. That has to leave. So that is still increasing what you're producing, right? Because now we've got this more robust hygiene program that includes the patients that are working their way towards gum disease. We're trying to back them out of it. And then the patients we have had and the ones that are coming through the door are getting diagnosed correctly.
Yeah. And that is very important. So look, one easy way besides running a report, which is not that hard to do in your software, but look at your schedule. Look at your schedule every day. That would mean that a third of your patients are either having their periotherapy treated or they're having perio maintenance, a third. So just do the math. If you see 8 patients a day, then you need to have a third of them being going every single day, going through some form of perio treatment. So it's a D4910 code, or it's your D434142, or your D4346. So,
and let's use those same numbers to do another way to look at what you're producing in comparison to what you're hoping to make. If you make $100 for the day, then you should be producing $300 for the day. Now, I hope that you're making more than $100 for the day, but just to keep it simple, whenever you produce an amount of dentistry, your compensation should not equal more than 1/3 of that.
exactly. So
that's a little bit backwards.
Yeah. So basically take what the doctor paid you. You know what you got.
And all the benefits.
It's all of your benefits. That includes your health insurance, your bonuses, your vacation pay, uniform allowance, CE, your licensing, maybe whatever the doctor is paying you that you don't have to pay out of pocket. We're not talking instruments and supplies. That's wholly different. But you need to be producing 3 times whatever that amount is. And so that means that you're profitable and you're delivering premium services, because not every patient needs a composite, right? So the doctor doesn't do a composite after composite. Not every patient needs a prophy. And so those were great statistics that you were talking about. And then one of the other things I'd like to bring up that makes you a premium hygienist is your actual acceptance rate. So if you have good communication skills and you first can identify what's health and what's disease, and then you are able to educate your patient as to why it is important for them to have something different than a prophy that you've been treating them with for years now, why that has changed, then your acceptance rate should be about 75% or higher. I see often in my private coaching clients that their acceptance rate, if they'll just open their mouth, is somewhere between 90 and 100%. So a lot of times they don't really understand that these patients that have been coming to them and seeing them forever will say yes because they trust them. They trust them. So you just need to open your mouth and you need to make sure that you understand health versus disease and that you're explaining and educating it well.
And here is a take-home tip. I still work clinically all the time. And one of my most effective answers to why we're doing something different is I will say what we're doing isn't working. We need a new game plan. So I have drawn the proverbial line in the sand and said the hygienist, maybe it was me, maybe it was someone else, and you, the patient, it's not about what happened. It's that what we're doing right now isn't working. So what are we going to do to move forward? And that one-liner will save you so much heartache. Jamie, on another day, I'm so excited to share with you how I get patients to diagnose their own gum disease, but we need to move to the assistants because they are an incredibly critical member to the team and an incredibly important member to the hygiene team. I find that when patients aren't sure what to do, both restoratively and in the hygiene department, they look to the assistants. So if I'm a premium assistant, what am I contributing to the team that is above and beyond my great attitude and my incredible teamwork and my taking out the garbage even it's not my turn? Like, what am I adding as an assistant?
Yeah, because those are basic qualities of a team member, right? Of a team person that has teamwork ethics is with what you just mentioned. But to be a premium assistant, I believe if you are a cosmetic office, could you as an assistant, with your qualities right now, not that you can't be trained, but could you do some cosmetic temporaries so that that patient leaves feeling like, oh boy, I hope the the final product doesn't look like this, you know. Do you know are you up to date with scanning and 3D imaging and taking effective vertical bite wings? So it's one thing to be able to do well at assisting the doctor, but what are the things that you can do that are above and beyond an assistant's duties? Do you have great and exceptional treatment conversions? So if a patient comes in, it's a new patient, and maybe it's a problem limited focus, and the doctor recommends a crown and a buildup or something like that, doctor leaves the room. Can you help that patient understand why it's important that doctor recommended that treatment and why they should move forward? So the doctor doesn't have to sit there and try to explain more of the whys and the hows, and that you can actually take over for them, just like we would want the hygienist to be able to take over for the doctor so the doctor can get to another patient's care.
So getting the patient to move forward with treatment is absolutely important for every member of the team.
Yes.
As a premium member. And then I think that there are a couple of business team overlaps with that. They've got to be able to get the patient to move forward. And they also have to get the patient to understand their options for paying for the care that they need. And so now that the hygienists and the assistants have worked in the back office, we also need premium contributions coming out of that highly paid business team member. So what would you add to incredible options for financing as well as getting them to schedule and complete treatment?
Well, I think the very first thing is not being afraid to talk about the patient's obligations when it comes to the financial part, that they could actually talk to them about that. And so when the patient says, I only want what my insurance pays for, an exceptional business team member can convert them and then let them understand that your insurance company is a financial institution and not the healthcare provider. And how do you get them to move into the other side of their mindset of saying, this is what I need because Dr. Smith, recommended them, and my insurance is not going to dictate what my health issues are and what I need. So that would be very important, that they can actually explain to the patient those things and do that treatment conversion with still having some empathy on how they can give them payment options. So they can do both. That would be exceptional.
Right. And I would also add that whether you're an assistant, a business team member, or part of the hygiene team, that time and financial commitment needs to be discussed at every juncture of the patient's experience. I believe that as a premium assistant or a premium hygiene service, your patient should have an idea that it's going to require their resources, which in this case is time and money, to get this care that they need.
The two most precious commodities that our patients are worried about.
Yeah, they need to already have a good understanding of what that's going to entail, so that the business team member has been set up with excellence to be able to go ahead and finish and close. You say close the deal, but it means ensure the care that patient truly needs. So great. So we know the different team members. What about that premium business owner? What does the premium business owner need to do?
Well, I believe wholeheartedly that they should not feel bad. If they're going to offer a premium price, they need to look at that candidate in front of them and ask them what premium services they will provide to the team and to the patient. And it's okay to ask them on their philosophies and what their perio percentage was. And I would just put it on my resume so that it's an open topic that I say, I'm proud of this. I'm proud that I am a premium hygienist and that I do this, this, and this. I would put that on your resume because that's going to stand out to the doctor, and they're not going to think twice about hiring you and giving you that price or giving you that compensation that you deserve if you can actually provide that you are that premium team member. I would say don't be afraid, business team owners, to ask some of these hard questions. And I would also highly recommend that there is I want to call it kind of the honeymoon phase, or maybe it's a dating phase, that they don't automatically get the job with all of the benefits and all of the everythings until maybe 90 days, 60 to 90 days of being there, and then sit down and review those premium services that you guys discussed that they offered to give to you. Now, there's a learning curve. We know that because every office is different. But I do think that the more is given, that more should be expected in return. So you don't have to feel as business owners that you've just had the wool, everything that you're sitting back on your back, not having a say so to all of this. I believe it can be a win-win for both the candidates and for the business owner.
Well, and I'm going to challenge you business owners out there to consider putting the things that you're hoping for in writing so that the expectations are clear for everyone. For example, in Pocatello, Idaho, when I am interviewing a new candidate for any position, I let them know that we operate as a family here. And we expect that everyone that is on this team is a positive contribution and is helpful in all aspects as far as the team dynamic, helping tasks be completed, and the way that we expect people to treat one another, treat the patients, and
be dependable, be a bit timid. Yeah.
All of the things. And so as a business owner, the more clear that we can get about what we're searching for, the easier time we have during those interviews being able to be confident and saying, this is what I am expecting. I am looking for someone that is going to be a fantastic addition to this team. And I, in return, have a fantastic compensation package. We're going to spend 90 days getting to know each other, making sure that we're an excellent fit. But here's what I'm hoping for. What are you hoping for? Make sure that all of those things become written down and a part of your contract so that the expectations are easily met by everyone. Clear as kind. So that is a fantastic way to make sure that both parties have the capacity, the ability to get what they want and need. And in the process, I believe that both sides of the team elevate and make our profession even better. So if you guys want to get a hold of us, you can find us at gemstatedentalgurus@gmail.com. We will put that in the show notes. Thank you so much for joining us today. Jamie and I are encouraging and challenging you to be a premium service provider.
Great. And reach out to us with any questions you might have. Thank you for joining us.
Thanks, guys.